Okay. Hi, folks. This will be another in an ongoing series of a couple of minute little YouTubes or whatever you want to call them for folks that get my email. I'd like to go into the Delta Dental Plan for Employees limits cleaning for healthy adults to 1 a year, and you can see this slide right now. Delta Dental, Michigan, Indiana, Ohio have reduced the number of cleanings for healthy adults 1 a year. Patients who complete an online risk survey and so forth and so on, and you can read the slide. Diabetes, history of stroke and heart attack, renal failure, dialysis, suppressed immune system, radiation are eligible to receive one additional up to a maximum of 4 a year. People with a history of perio disease can have 3. All others who do not meet the conditions are limited to 1 per year. This is the article I sent you in the previous email. I want you to pay very strict attention to this because I'm telling you right now, all insurance companies are going to now do this. It's not the companies. Remember, these are the plans they're offering that the employers wish to purchase. Therefore, if you are going to participate, we all know you're going to see less hygiene patients. Your hygienist may be not as busy. So what we have to do, and I said it over and over in my lecture, is bill for what you do. And I'm going to very quickly go over what I feel are the biggest losses of income. You might remember them. 0140, please, that's the limited oral exam. Bill it if it's an unscheduled visit. 0180, that's the new patient comprehensive exam with, if possible, perio patient. Fully half of your adults fall into that category, and your fee should be higher than on 0150. 9110, multiple areas, and if you, as I've mentioned any number of times, if you get Dr. Blair's book, it is well covered in his book, and I certainly covered it in my lecture. And also D4342, which is the limited scaling and root planing 1 to 3 teeth, probably the most underutilized of all codes, and I spent quite a bit of time on that. I may follow up on that in a further email with you folks, but please, again, Dr. Blair's book goes into it in great detail. And don't forget, with 0180, once a year, 49 with a 4910, much higher fee. We all know companies don't pay, not all of them do. It doesn't matter. If the patient has to pay, they'll pay. They are not going to leave your practice. Also, following up, 7210, surgical extraction. It has changed, and it's gone back to where you don't have to have a flap. And if you have removed bone and or sectioned the tooth, then you can bill the surgical extraction. And doctors are finding they still think I have to have a flap, and they're losing enormous sums of money. So please pay attention to those things. And also, of course, they're cutting back on x-rays to sometimes once a year, once every 2 years with the bite wings. So please, bill the codes that are appropriate, and key, your records must back up what you did. And finally, you'll find something in the email about my frequency analysis. Some of you might want to contact me about it. I'm starting to get real busy with that, and I think the docs and officers really feel like they've got something out of it. Anyways, that's it for this time, and you'll hear from me again pretty soon. Bye-bye.